as we have gone from a life expectancy of maybe 50 years of age in the year 1900, well, now everybody's pretty much expected to live in 80s. And so it's interesting how that has shifted the focus on what happens as you get older. And so the notion of replacing hormones as people age is very old. It was done at the times of the Greeks. But at the end of the 19th century and the beginning of the 20th century, things got organized. And matter of fact, the name hormone was coined in the year 1904. Nobody knew that name before. It was created in England by one of the fathers of medicine, Dr. Starling, the one of the law of the heart, who was having lunch and was describing these things that they were finding. And then there was a Greek professor having lunch behind them. And then when he heard them talk, he said, "Oh, I have a name for that." He said, "It's hormone. It's hormone. That means I make things happen." And that's history. So it's interesting how that happened, because hormones do that. They make things happen. And when they leave, things don't happen as much and people find out. There's a lot of controversy about, is there andropause, is there not andropause? What we know is that there is a decline in testosterone with age. And obviously the question has been raised, would it be advantageous to replace it when people run too low? So the state of affairs now is such that there's a lot of conflicting evidence. The latest studies show that, for sure, no one should approach testosterone replacement as a panacea for, I'm going to do that and stay young forever. That's not how it's going to work. Having said that, there are cases where men run into enough low testosterone to have problems. And it's being pretty clearly demonstrated that low testosterone as you age increases your mortality, decreases your quality of life, and there's a lot of other unpleasant facts of that. Does that mean that everybody who's getting old should be getting testosterone? The answer is absolutely not. So there are guidelines, and actually in the last few months some very interesting studies came out showing how some controversial issues are actually receiving some light. Like, for instance, there were a few studies that threw a negative light on testosterone as far as cardiovascular disease in the last 5 years, say so. Upon deeper analysis, they were found flawed, some actually being retracted. There's more evidence now, and there's a strong tradition, for instance, of testosterone and cardiovascular disease in Germany, and some of that is coming over. And so people are finding that actually maybe in many cases, if you know how to select your patients, again, people do better. As far as body composition, as far as quality of life, it seems like it is in this field that there is a golden time of replacement. And then as you get older, you should expect less results and clearly go, if you do it, with lower doses. Golden time is probably, the younger is the patient, the easier it is to do. The body is more responsive, the receptors are there, you see the changes, and the same thing happened with the women. The older they are, the more careful and delicate you need to be, because it becomes a different biological system. I see men with low testosterone in their 30s. and I mean significantly low testosterone. And I see men in their 80s with twice the testosterone these other men. I think that there's a lot to this, because one natural way is that the hypothalamus, hypophysis, testicular axis gets older. But when you see a 35-year-old coming with a testosterone of 150, that's more going on to that. And so it's interesting how the diet, the toxicity, we live in an estrogenized environment due to a number of reasons that have to do from drugs, the industry, to plastics. And this is becoming an issue in pediatrics. And then there's drugs, and there's stress, and there's the American diet, and all these things. So I see a fair amount of men that go from their 30s into their 80s.